You, yes you, the one sitting in the chair. I want you to get your immunizations. Oh, you're not sure what immunizations you should get? Don't worry. You're like many other American seniors who aren't sure what immunizations they need. Now that I have your attention, let's take a closer look. What is an immunization? An immunization is a way of making a person immune to a disease, specifically by vaccination. So what's a vaccine? A vaccine is a substance often given by injection that protects against a disease. Vaccines contain a dead or weakened version of a microbe, which spurs the immune system to recognize and destroy the living microbe during future infection. Why do I need vaccines? Well, vaccines help protect you against diseases that can be serious and sometimes deadly. The shots you got as a child can wear off over time, and as you get older, you may be at risk for other illnesses like shingles. Vaccines don't just protect you, they also protect the people around you. Some people in your family or community may not be able to get certain vaccines because of their age or health condition. Are vaccines safe? All vaccines used in the United States are required to go through years of extensive safety testing before they are licensed by the U.S. Food and Drug Administration. The FDA and CDC work with healthcare providers throughout the United States to monitor the safety of vaccines, including for any adverse events, especially rare events not identified in pre-licensure study trials. But I've always been told that I would get the flu when I get the flu shot. Well, that's a myth. Vaccines contain the same antigens or parts of antigens that cause diseases. However, the antigens in vaccines are either killed or greatly weakened. Vaccine antigens are not strong enough to cause disease, but they are strong enough to make the immune system produce antibodies against them so that they can fight the disease in the future. Vaccination provides us with immunity without suffering from the diseases the vaccines prevent. So what shot should I get? Well, your current recommendations are this. Get a flu shot every year. The seasonal flu vaccine is the best way to protect yourself and others from the flu. Get the Tdap vaccine to protect against tetanus, diphtheria, and whooping cough. Get a TD booster shot every 10 years after the Tdap shot to protect against tetanus and diphtheria. If you're age 60 or older, get a shot to prevent shingles. Shingles causes a rash and can lead to pain that lasts for months or years. If you're a diabetic, you should also get the hepatitis B series before age 60. If you're age 65 or older, get a pneumonia shot. This shot is sometimes called PPSV. Most people only need to get the shot once. So what should I do to prepare for my vaccines? First of all, you need to make sure you're well and make sure you're healthy. Also, if you've received other vaccines within the past 4 weeks, you may not be eligible. You should be prepared to complete screening tools and consent forms and also receive a VIS. So what is a VIS? A VIS, or Vaccine Information Statement, is a document produced by the CDC that informs vaccine recipients or their parents or legal representatives about the benefits and risk of a vaccine they are receiving. All vaccine providers, public or private, are required by the National Vaccine Childhood Injury Act to give the appropriate VIS to the patient prior to every dose of specific vaccines. So what is my vaccine going to cost? Well, insurance may help pay for vaccines. Insurance generally pays for vaccines, but there could be co-pays or deductibles depending on your plan. Sometimes the vaccine has to be administered by a primary care doctor to check to see if you need to visit your physician or if you can just go to your local pharmacy. For those on Medicare, Part B covers influenza and pneumococcal or pneumonia vaccines, as well as the hepatitis B vaccine for persons at increased risk of hepatitis, and the TD vaccine as part of wound care. Those with Medicare Part C or D may also have coverage for additional vaccines like the zoster or shingles vaccine, MMR, which is measles, mumps, and rubella, and the Tdap, tetanus, diphtheria, and acellular pertussis or whooping cough vaccine. Check with your state Medicaid office to see which vaccines are covered under this program. We all know what it's like to get that dreaded shot, so what should we expect afterwards? After the vaccine, 50% of adults say they have pain and soreness at the site. Another 20% say they have redness, 20% experience headaches, and the good news is allergic reactions, which include high fever, difficulty breathing, rash, hives, itching, and throat swelling, are less than 1 in 1 million. So just in case you aren't convinced, here's a picture of the nasty shingles virus. As mentioned before, it's very painful. There are many things adults do to stay healthy. We eat right and exercise. We get recommended cancer screenings. Make sure you get those recommended immunizations that you need. If you have any questions, be sure to ask your doctor.